In my last video, we talked about why rest won't fix knee pain. They need to be loaded and they don't do well with total rest. Today, we're going to take that a bit further and we're going to talk about how to treat knee pain without surgery. I'm Dr. Imbuldeniya. I'm an orthopaedic knee consultant surgeon. I've been a consultant now for over 10 years, and during my 25-year career as a doctor, I've treated thousands of patients with knee pain and knee injuries. The last 10 years as a consultant, I've spent a lot of time looking inside people's knees, either with a small camera or through larger incisions. So if anyone can understand what's going on inside your knees, it's going to be me. As a knee surgeon, I'm incredibly lucky. I get to meet my patients, I get to hear about their stories, so I get to examine their knees and understand where there's any tightness or laxity or any abnormal movement or any difference in posture. We get to organise advanced imaging like 3 Tesla MRI scanning or CT scans or x-rays. I then get to see the patients again with that information and make a judgment call on why they might be having issues. Often I'll get to operate on patients if non-surgical treatment hasn't worked, and then I can then understand exactly what's gone on, go back and look at their scans and tie it all together. And I think as an orthopaedic knee surgeon, that puts me in a real position of advantage compared to all the many other types of excellent allied health professionals that might see you, as it's only orthopaedic knee surgeons that actually ever look inside your knee and then can see what's going on inside and then look back at the scans and kind of all the benefit of a retrospectoscope. Because I see the joint from the inside, I get to handle the cartilage, the ligaments and the bone with my own hands, though they are gloved, often double gloved, and I get to repair the damage and I can compare what I see on the MRI scan. This gives me a complete 360-degree understanding of your knee, from movement to real tissue. Physiotherapists, osteopaths, sports and medicine doctors, radiologists are incredibly skilled at looking at scans and understanding what they can see on scans and x-rays, but I connect all of it as an orthopaedic surgeon, and this helps me understand when the knee can heal itself naturally and when it might need an intervention like surgery to help you get better. So knee pain is very rarely caused by just one structure. It's often a combination of weak gluteal muscles, which are either at the side of your hip or at the side muscles are called the gluteus medius. The ones at the back are called gluteus maximus. It's sometimes due to cartilage or meniscus wear inside the joint, poor biomechanics from years of sitting or years of overtraining, or inflammation, which can be linked to what's called your metabolic health. After seeing inside thousands of knees, I can tell you scans don't always match your symptoms, because scans are basically pictures of your knee, and though they can show us a snapshot of your knee, they don't always match how your knee might be making you feel. And sometimes people with scans that can look fairly serious feel pretty good relative to them, and conversely, people that have what seems like minor injuries or minor damage on their scans, it can really affect them a lot, and you might find this is applied to you. The goal really is for you to understand why your knee hurts, what the root cause is, and not just trying to mask the pain. So for me, there are 4 foundations of non-surgical treatment. Number 1, muscle activation and strength. Strong muscles work like shock absorbers. When your gluteal muscles around your hip and your hamstring muscles on the back of the thigh are relatively weak, if your quadriceps muscles are too strong, your kneecap bone, your patella bone, which is at the front of this model knee here, gets pushed in, which your quadriceps muscles are on the front of the knee. So this is the front of the knee, this is the femur bone or the thigh bone, this is the lower bone in your leg called the tibia or the shin bone, the little oval bone is the patella, and the knee moves like this. So when your quads are too strong, stronger than the hamstrings at the back or stronger than the gluteal muscles at the top and the hip, then you get pressure between the femur bone and the patella bone, and that can cause what's called anterior knee pain. Some practitioners call this patellofemoral pain syndrome or patellofemoral overload, because it's between the patella bone and the femur bone. Weak muscles mean each step sends more impact through the bone. The cartilage is the smooth, slippery lining that caps the end of each bone. There's cartilage here. You can call it articular cartilage, is its proper name. There's also articular cartilage here at the top of the tibia, and those surfaces need to be smooth. The cartilage has a very poor blood supply, it doesn't have any nerve endings. When it gets damaged, it often stays damaged. There is some capacity to healing, but we'll get into that at a later video. Building muscles around the joint protects shock and protects the cartilage and the other structure in the knee, which is also a type of cartilage. It's called meniscus. Here's meniscus here. Meniscus is a C-shaped rubbery disc that's placed between the bones. There's two of them. There's one more in the inner part of the knee, the medial aspect of the knee, and there's one here again on the outer or lateral aspect of the knee. So you have the medial meniscus or the lateral meniscus. They are really important shock absorbers as well, but can get injured if too much force is put through them because your muscles are maybe a little bit weaker than they should be, or some muscles are relatively weaker than other ones. The most effective approach I find, and I do this myself, so I practice what I preach, is to get to the gym, get on those leg machines and do each exercise for all the muscles of your lower body. 8 to 10 reps. You do each exercise 8 or 10 repetitions, and you have a break for about 1 to 2 minutes, and you go again for another 8 or 10 repetitions. You have another break for 1 to 2 minutes, and then you go again for a final 8 to 10 repetitions. So that's called 8 to 10 reps, 3 sets. If you do that for each muscle group, you're going to get really strong. If you can even commit to that once a week, it normally takes me about 1 hour to sit in the gym and do that. And I'm super busy as a consultant surgeon. I've got a family, I've got 4 children, busy job, lots of things to do just like yourself, but you've got to make the time, it really helps. That range, about 8 to 10 reps, normally helps build big, strong muscles. If you can go twice a week, even better. But it's really important not to go too much. If you go 4 or 5 times a week, that's too much, and your body and your muscles can't heal and mend and grow stronger. So rest days are super important. So too little exercise isn't very good. Too much exercise and too much doing the same thing is not good. Your body needs different types of exercise to feed it. So you might need muscle strengthening, you might need a cardio day where you do some jogging or some rowing or some cycling. You may need a day where you're learning about balance, like yoga, and that's also a type of strength where you're building stamina as opposed to strength. So yoga or Pilates builds a different type of strength. And you also may need plyometric or jump training, which often involves running or jumping, sometimes putting it all together and playing sports like football or rugby, or tennis if you're not into team sports. That often puts all of those skills together and really also helps with proprioception, joint awareness, and complex movements. Lots of people have slightly weaker gluteal muscles, in particular gluteus medius, which is on the side of the hip. So everyone thinks about gluteus maximus, which is the large muscle that sort of forms your bum, the muscle on your bum. But the one underneath it on the side is called gluteus medius because it's medium sized. There's also a gluteus minimus underneath medius and a little bit to the front, but it's the medius that's important. That helps you walk, it makes you stand when you're standing. I stand on one leg like this, I'm standing, my gluteus medius is holding me up. When you go upstairs or up hills, it's your gluteus medius that does the work. So it's an important one to strengthen. How do you strengthen it? Normally abduction exercises works where you push your leg out to the side. Gluteus maximus would be hip extension or hip thrusts. So it could be stepping up onto something like a box. Quadriceps strengthening, maybe a leg press or a squat, pushing your foot away. And often I'll do that both legs at the same time. Hamstring work can be lying on your tummy and doing what's called a hamstring curl. So lying on your tummy and bending your knee up against resistance. So if you're not familiar with the gym, You can definitely find one that suits your price range, from really good low-cost budget ones all the way up to high-end luxury ones if you've got the wallet to match. But I would absolutely recommend joining if you haven't, and trying to commit to at least one session a week. And when you join a gym, you'll get a trainer will show you around for an induction, and that's with all of these gyms. And nowadays there's lots of apps that can help you, and I can talk about some of the apps that I use for exercise, and I'll talk about that in another video. Or you can ask people in the gym. The gym community is incredibly friendly now and very inclusive, much more so than many decades ago. Number 2, mobility and movement nutrition. Cartilage has no direct blood supply. It's fed by the synovial fluid inside the joint, fine, but each time you bend and straighten your knee, the fluid, or the synovial fluid within your knee, flows and releases nutrients that feed the cartilage. When you stop moving, the cartilage dries, there's less of it, knee gets stiff, and there's less nutrition flowing. So movement is really key. Movement is so important for your joints, and that's why it's important that you're not too sedentary. We were made to move and made to walk. We were not made or designed to sit in front of the TV all day, sit at an office all day. Yeah, we were not made or designed to sit in front of a TV all day, drive all day, or sit at the office for 8 hours. So making sure you keep mobile even when you're not weight training each day, either gentle knee bends, holding onto a chair and dipping down, light cycling or going on a cross trainer, even for 15 minutes each day, absolutely fine. The key is consistency. You want to do these exercises that are manageable, short bursts, things you can achieve, things you won't feel bad about if you can't do it. Don't set your goals too high, set them really low, but try and be consistent. Make these habits just like brushing your teeth. In fact, you can do what's called habit stacking, which is where you add on a habit to a pre-existing habit. So it may be that as you brush your teeth, straight afterwards, you're gonna get on your static bike and do 15 minutes of cycling, or you're gonna do 10 gentle squats just before you get changed for the morning. Number 3, load management and lifestyle. Every step when you're walking applies about 2 to 3 times your body weight through your knee, and 5 to 6 times your body weight when you're running. If your muscles are weak or activity spikes suddenly, tissues rub together and get pressed on each other and can get inflamed. Chronic overload causes micro-inflammation. The knee and the tissues in the knee that are normally thin and glide nicely can get swollen, puffy and sore and impinge or rub on each other. You get a release of chemicals called inflammatory mediators that make you feel pain. Managing load doesn't mean you have to stop, it just means you need to adjust. Swap high impact activities like jogging for cycling initially. Break really long walks on inclines into shorter walks on the flat. Look at your footwear, try and wear really cushioned soles. I wear Hoka trainers. I'm not sponsored by them, but they often have an inbuilt sole or a thicker supported sole, as I have slightly flat feet, and that really helps me. So have a think about your footwear. Wear comfortable, well padded footwear. Number 4, metabolic and recovery factors such as nutrition. Mediterranean foods, extra virgin olive oil, berries, wholesalers, lentils, dark greens such as kale, spinach, all excellent to reduce inflammation and keep you healthy for longer. Pain isn't only mechanical, it's biomechanical. High blood sugars caused by eating complex processed foods or sugars and fatty foods release inflammatory molecules called cytokines, and these can circulate, get to your joint and exacerbate or worsen inflammation and pain. They can also slow down repair of your tissues such as cartilage and tendons. 2 people can have identical wear and tear in the cartilage in their knee, but because of their metabolic health or what they put into their bodies, whether it's the amount of alcohol or the amount of fruit and vegetable they eat, they'll have different responses and reactions to their knee. One knee may be really aggravated and painful and sore and swollen, and the other knee may be much less so because of the natural anti-inflammatory power of what that person is putting into their body. Sleep's so important too. You've got to try and get 7 to 8 hours sleep. You've got to get off your phones early. I'm really guilty of this, and my wife now is super strict and makes sure that my phone is off at least about 1 hour before I go to bed. And then you just gotta try and get into rhythm, go to sleep. Again, we'll have another video talking about sleep and how you can do it. It's really difficult when you're really busy, when you're stressed, when you've got lots of things on your mind. I've been there. Sometimes I have lots of stress about family things or work things, and I find it really difficult to switch off. But it's so important, as you know, if you have a good sleep and you wake up naturally the next day, you've got so much more energy and you're more likely to make good choices, eat the right food, stay hydrated and do that exercise that you're meant to do. If you're tired, it's really difficult. We've all been there. So when is surgery necessary? And as a surgeon, I know, operating on patients every week, that not every knee can recover without surgery. Certain specific emergencies are rare, but if your knee locks or it gets stuck because you've had an injury, it often means a rubbery structure, potentially like a meniscus, which I'll show you again on the model here. Maybe that the meniscus tissue has moved and it's stuck between the bones, and often actually then, if it's not going to move again or unstick itself or unlock, sometimes surgery is needed to push the tissue back and fix it, repair it and sew it up so it doesn't tear again. But these sort of scenarios are often really rare, and often most knee pains and knee injuries can be treated really, really well non-surgically first. And if for whatever reason that doesn't work or it doesn't get you the result you want, then we always have surgery options that we can talk about that can then help. So to recap, most knee pain doesn't need surgery. No knee pain, and nearly all knee pain doesn't need surgery as a first option, except something like an acutely locked knee, for instance, or a serious ligament injury from a trauma where multiple structures or ligaments in the knee, like these are ligaments, these are structures that stick bones together. If lots of them are torn, then you probably will need surgery at some point. But generally, most of the time, you just need the right advice, potentially a knee support initially, gentle exercise, good diet, good hydration, and you need to keep moving. Strength, movement, and load management and metabolic health form the foundation of your recovery. After 25 years of being a doctor and at least 15 years of seeing both inside and outside knees, I can tell you that intelligent movement heals. If you'd like to know more about how you can get a personalised assessment and how you can keep your orthopaedic longevity or OrthoLongevity, you can find more links below. And if you haven't watched my first video, Rest Won't Fix Knee, it's linked below as well. I'm Dr. Arj. Thanks so much for watching. Next time we're going to talk about how to future-proof your knees for life.